So today we're diving into a really fascinating story about adaptation. This isn't just another talk about AI coming for our jobs. Nope. This is about how one specific medical field is proactively building its own AI-proof future. And honestly, it's a playbook that pretty much all of us can learn from.
You've heard the question a million times, right? Is AI making doctors obsolete? I mean, with these systems getting scarily good at things like reading scans and diagnosing diseases, you have to wonder, are we heading for a future without human doctors?
Well, it turns out that might be the completely wrong question to ask. For a field like radiation oncology, the real immediate threat isn't being replaced, it's being compressed. Think of it like their entire world, their whole workflow is just getting squeezed by technology. It's a much more subtle threat, but believe me, it's happening right now.
So let's talk about this AI squeeze. This isn't some far-off sci-fi scenario. This is the real-world pressure that technology is putting on highly trained specialists today. So what does that actually feel like on the ground?
The core idea here is something called productivity compression. The best way to picture it is to imagine the walls of a room slowly but surely closing in on you. The AI and the automation, they're the walls. They let fewer doctors get way more work done and do it faster. Now that sounds great for efficiency, right? But the side effect is that the total amount of available work starts to shrink. And that means less economic stability for everyone in that specialty. And you can absolutely feel the effects of this. We're talking about things like payments going down, having a smaller and smaller role in a patient's overall care, and seeing the traditional tasks you used to do just get automated away. It all adds up to a much tougher financial reality for the individual doctor. It's kind of like a slow-motion erosion of your professional value.
Okay, so what do you do? How do you fight back against that squeeze? Well, you're not going to win by trying to resist the technology. That genie is way out of the bottle. The only move you have, the only real strategy, is to expand your value. You have to find new ways to contribute, new problems to solve that the technology can't handle, at least not yet.
And this is where it gets really interesting, because two main strategies are emerging. On one hand, you've got low-dose radiation, or LDRT, which is all about repurposing the tech you already have for a massive new market. And on the other hand, you have Radioligand Therapy, or RLT, which is about diving headfirst into a brand new cutting-edge technology. So one path is about going wide, and the other is about going deep.
All right, let's break down that first path, low-dose radiation therapy. You can think of this one as the rediscovery. It's all about taking a tool that's been sitting on the toolbox for a while and realizing it can solve a huge, overlooked problem.
Just look at that number, over 30 million. That is a staggering number of people in the US alone who are living with the pain of osteoarthritis. And here's the kicker. LDRT is a pretty standard treatment for this in places like Europe, but for whatever reason, it's been mostly ignored in the States. That is a massive, underserved patient population just waiting for a solution.
And that's what's so brilliant about this strategy. It's not about reinventing the wheel. Clinics can use the skills they already have, the equipment they already own, and start helping a whole new group of patients. It's an incredibly practical way to add a new service and stabilize their business in the face of that compression we talked about. And this isn't just some abstract idea. There is a clear step-by-step roadmap to make this happen. Organizations like the Radiotherapy Academy for Benign Conditions are already out there offering the training, the clinical protocols, and even the marketing help to make this a legitimate turnkey solution for any practice looking to expand. Okay, so now for the second path, which is a totally different way to build value. This is Radioligand Therapy, or RLT. If LDRT was about rediscovery, RLT is all about charging ahead and embracing a new frontier to stay ahead of the curve.
So, how in the world does this work? The easiest way to think about it is like a smart bomb for cancer. It's genius, really. You take a molecule that's specifically designed to hunt down and latch onto cancer cells, no matter where they are in the body. Then you attach a tiny radioactive particle to it. That molecule delivers the radiation right to the cancer's doorstep, taking it out with incredible precision.
And the potential here, financially speaking, it is absolutely mind-blowing. The global market for RLT is projected to explode to almost $40 billion in less than a decade. We're not talking about some small, niche treatment here. This is on track to become a major pillar of cancer therapy. So why is this such a natural fit for radiation oncologists? Well, it taps directly into their core skill set.
things like radiobiology, which is the study of how radiation affects cells, and dosimetry, which is the science of measuring radiation doses. It's right in their wheelhouse. Plus, with treatments already approved by the FDA and a ton of training programs popping up, the path to getting on board is becoming really clear.
So let's zoom out. What's the big lesson here? Because this really isn't just a story about one corner of medicine. It's a masterclass in what we could call the adaptation imperative, something that is going to affect every single one of us in the age of AI.
When you boil it all down, these two paths, LDRT and RLT, they are so much more than just clever ways to make more money. They are a vital, necessary counterbalance to those forces of productivity compression. They represent a deliberate choice to expand the value you provide instead of just sitting back and watching it get squeezed away.
But, and this is a really important but, we have to stay realistic. As Dr. Brian Lawenda, who is a key source for this story, puts it, these strategies aren't the final answer. There's no permanent magic bullet here. They are, however, incredibly powerful tools that can help, for a time, to fight back against the changes happening right now. They buy you time and help you build relevance in a world that's changing faster than ever.
And that brings us to the final big question, the one for you. This story gives us a blueprint for how to grow and adapt in the age of AI. So take a look at your own world, your own career. As technology keeps marching forward, where are the hidden growth paths in your field?